We now elicit the reflexes of the lower limb. We start by looking at the knee-jerk reflexes. So we'll rest the patient's leg on my arm. We'll ensure that the patient is fully relaxed. 我想你盡量放鬆喎。依家會同你睇一睇啲神經反射。And then with the thumb, we'll palpate along the patella and feeling for the patellar tendon. With the tendon hammer, we'll gently strike at the patellar tendon to elicit the reflex. So we'll do the same thing for the left side. Again, resting the leg on the arm. 我想你盡量放鬆下。We feel for the patella and then the patellar tendon. And there's the knee-jerk reflex. And reflexes can be characterized as normal, hyperreflexic or brisk, or hyporeflexic or areflexic. To elicit the ankle reflex, we'll position the patient's leg so it is flexed at the knee, and we'll gently dorsiflex the foot. With the tendon hammer, we're aiming at the Achilles tendon and looking for the flexion of the foot. Okay, and again. Before proceeding to eliciting a reflex on the left leg, we should straighten the right leg first. And then again, we should flex the leg at the knee, gently dorsiflexing the foot, and then aim at the Achilles tendon. And again. Now straighten the patient's leg. Finally, we should proceed to elicit the plantar reflex. The orange stick is ideal for this purpose, and we should never use the sharp end of a tendon hammer, as this reflex can be quite uncomfortable. To elicit this reflex, we should start at the inferior aspect of the sole, striking upwards and laterally of the sole, and then working medially towards the big toe. 有少少唔舒服啊。So in this individual, the plantar response is downgoing. However, if the plantar response is upgoing, where there's fanning of the toes, or the big toe it points upwards when the sole is being struck, this patient would be classified as having an upgoing plantar response, or a positive Babinski sign.